Binge eating disorder is a disorder that involves the behavior around eating such that a person feels out of control. And as a result of being out of control, they will have additional manifestations that would be in terms of feeling guilty, embarrassed, disgusted after the episodes. It can actually lead to further weight gains, other psychosocial complications, as well as disabilities. That has been in the DSM-5 always listed as a EDOS, and just since May of 2013 began to be qualified as a diagnosis, psychological diagnosis in itself. And they have changed the definition so that it's no longer, the episodes aren't 2 per week for 6 months, it's 1 per week for 3 months. The main thing is that it gets confused with people who overeat or indulge, as opposed to there is a psychological core to why it occurs. And in terms of what drives that behavior, it's important that it's not about hunger and it's not about weight issues. And that's where we can begin to make a difference in these people who continually to basically be set up for failure by going on diets and being in a society that doesn't understand the disease. So this is something that's been needed for a long time to be addressed, and insurance has finally recognized it because the DSM-5 is something that needs to be treated. And I think it has potential to be kind of over-diagnosed, because the qualifications seem to fit a lot of people, but it's really that core psychological component. Classically you'll see all of the continuum of psychological disturbances, trauma, attachment issues, affect regulation, depression, and anxiety, and until the person addresses those, this disorder cannot go away. So many of them may seek surgery or may seek medications, may seek diet plans, whatever, but it's going to continue to cycle itself because they're not getting at the real core issues.